Kevin, and it's really great to be back at Duke. I went to law school more than 20 years ago, so I won't tell you my graduation date, but really nice to be back. So I've been working in South Asia over the last 7-8 years, and I wanted to just share the progress that we've made, and I've tried to kind of sort of parallel it with progress globally as well as in the US, just so you get a flavor of where South Asia stands with the rest of the world. So just a quick snapshot, so currently the global smoking rates is 35% men and 6% women. So it's a total of 1 billion people in the world that are using some form of tobacco. And I want to say that it's interesting in the US, so the rate for men in the US is actually half of the global rate, but the rate for women is actually double that. So that's an interesting statistic that I just want to highlight. And I want to say that the reason that we've really focused on low and middle income countries is that 80% of the world's tobacco users live in low and middle income countries. And a majority of them live in South Asia, the region where my work is focused. Just a little snapshot on that picture. So if many of you, I think some of the students may not know this. So in 2010, when I began my work, the most sort of significant story on tobacco use in the world was the smoking baby from Indonesia who was smoking 40 cigarettes a day. He was 4 years old, and his parents, sort of as a way when he would cry, to stop him from crying, would hand him a cigarette. So this is a picture of me carrying him, which was also an effort in like weightlifting. But it's really interesting. He had gone down from like 2 or 3 cigarettes by the time I met him. But what was really sad is when I sort of reconnected with him a few years later, even though he'd given up tobacco, because of sort of the addictive behavior that he had become inclined to, he was then addicted to junk food. So it was really sad, and this is very common in Indonesia. They have at least over 5,000 babies below the age of 5 who are addicted to cigarettes and are using like 30 plus cigarettes a day. So just wanted to just briefly emphasize that tobacco is the leading cause of preventable death globally, and it kills more than up to half of its users, which is around 7 million each year. The one data I want to emphasize is around 900,000 of them actually die from second-hand smoke. So these people did not take up the habit, but they're dying from second-hand smoke exposure. So whether they're the spouses of smokers or those working in facilities that are no longer tobacco-free, whether it's restaurants or bars or workplaces. And I think the data that is particularly important for me when I'm doing my advocacy with countries like India or Bangladesh, where the argument that's put forth by government is that we get such a significant revenue from tobacco, and how do we pass strong laws to regulate tobacco? And we always want to point out that the economic burden of tobacco far outweighs the benefits from tobacco. So for an India example, the revenue from tobacco is only 17% of the economic cost that it costs the Indian government. And that's something which is lost a lot of times in policymakers unless you kind of share the data with them. So that's the problem, and then I come to the solution. As Gavin mentioned, there's only one global public health treaty in the world. The world recognized there is a huge problem, and they came together in the early 2000s, and they passed the Framework Convention on Tobacco Control, which sets sort of policy standards that the countries need to adopt. And I want to say there's remarkable progress. 181 countries have adopted the FCTC and are engaged in active implementation. I just want to not point out the big white gap where we stand. Of one significant country that has not adopted the FCTC, like many treaties, but I do want to say that that's really important, because a lot of times, I was before a parliamentary group in India, and they're like, well, your country is doing nothing about it, why are you here trying to convince us about it? So that's an argument that's often sort of pushed back on us. So a little bit about, how my work is enabled is, Mayor Bloomberg started philanthropy, early on. He was one of the 15 richest men in the world, and I think around 12 years ago, when he was beginning his public health efforts, he actually got guidance from Tom Frieden, who had been his health commissioner and then went on to become the CDC head during the Obama regime. And he advised Mayor Bloomberg to actually focus on tobacco use in low and middle income countries. And so in 2006 started the Bloomberg Initiative to reduce tobacco use. And he's continued with this initiative. We are funded till 2022. And his total commitment to date has been $1 billion. Which is obviously really significant and allows us to really make a big impact. Just for framing, so these are the 6 organizations that are funded with the $1 billion, and most of the money is actually given to organizations, research organizations, NGOs, legal groups, media groups in the countries that we work in. My organization is the Campaign for Tobacco-Free Kids. And our role is very much to kind of lead advocacy efforts on policy change as well as to make grants. We have the Centers for Disease Control, which actually partner with countries in conducting the Global Adult Tobacco Survey, which is the largest sort of tobacco use survey of its kind. Our research partner is the Johns Hopkins Bloomberg School of Public Health, just to emphasize. So Bloomberg actually, is an alumni and has made significant contributions, and they're our research partner. The WHO, Vital Strategies, which actually supports paid media. So for those of you who've ever watched a Hindi movie or any Indian movie actually, the ad that you see in the beginning, which sort of talks about no tobacco use, that's been made with Bloomberg funding. So any Indian movie that, that ad that you're forced to watch about no tobacco use is made with Bloomberg funding, and the International Union Against Tuberculosis and Lung Disease is another grant-making organization. So today my talk's going to sort of use the MPOWER framework, which is the framework that WHO came up with. So FCTC is sort of the treaty that sort of forms the obligation that countries have, but it didn't provide an implementation framework. And so WHO, along with global experts, created this framework which allowed countries to actually implement the FCTC as well as measure progress. And so there are 4 key policies within MPOWER, which are sort of the key ways in which we've seen significant reductions in prevalence in countries. So those are protect people from tobacco smoke, warn about the dangers of tobacco, enforce the bans on tobacco advertising, promotion, and sponsorship, and raise taxes on tobacco. So I'm going to focus a little bit on sort of global, US, and South Asia status in all 3 of on these 4 policies. So just to go back to sort of South Asia. So when I'm talking about South Asia, it's like these 9 countries, sort of what was sort of the greater Indian subcontinent, and it goes all the way from Afghanistan to Myanmar, and obviously the largest country is India. So we've got 1.5 million people dying from tobacco use in this region every year, of which 1 million alone are in India because of the population size. And I think that's one of the things I'd like to emphasize is that in this region, even much greater than smoked forms of tobacco, which includes not just cigarettes, but something called bidis. I think the biggest prevalence rates, and I won't go through this data, is really smokeless tobacco. So I want to really emphasize that smokeless tobacco is an even greater problem than cigarettes and bidis. Most of the countries, if you look at the smokeless tobacco rate, is much higher. So in India, the smokeless tobacco use rate is double of the smoking rate. In Bangladesh, it was amazing, which we found with the GATS data. The smoking rate amongst women was like 2 or 3%, but the smokeless tobacco rate was actually 20%. Because smokeless, there's a lot of taboo culturally about women smoking, till recently, but there is clearly, women have been using smokeless tobacco in the rural setting, and now even more in the urban setting. So that's a big challenge that we have in this region. So the first policy I'm going to sort of talk about is protecting people from tobacco smoke. So the most important thing for you to know to protect yourself is there is no safe level of secondhand smoke. So those of you who are hanging out with a friend who's smoking, I think you're inhaling, those 7,000 chemicals and 69 carcinogens. So think again. I think I want to emphasize that there is, increasing research around sort of secondhand smoke and its impact. The other point that I want to emphasize is that partial smoke-free bans are not effective. So a lot of countries giving into the tobacco industry have implemented bans which allow for a designated smoking room or area, and those don't work because unless you have 6 walls and 6 doors, the smoke always leaks through. So there is no way to really protect workers in a restaurant or employees in an office. And so I think that's something that we've really emphasized. The other point I really want to make about this is that we don't have really good studies, and for researchers in the room, I'd want to plug this in. But in countries where we've implemented very strong smoke-free laws, we find that it has a really significant impact on behavior change. So in changing the social norm, because if you're at work here and you don't get to smoke all day, then you're very unlikely, you're sort of unlikely to smoke the same number of cigarettes at home. So it has a huge impact on behavior. So a lot of countries' data we're seeing with strong implementation of smoke-free laws, we're seeing that smoking at home has reduced significantly. So that's something that we don't yet have good studies to prove, but that's an important point that we're finding globally with the data. So here's where the world stood just 13 years ago. Ireland became the first country to implement comprehensive smoke-free legislation, and this is where we stand today. We have 56 countries that have enacted comprehensive smoke-free laws. The US is not one of them, but here's the status in the US. So we've got 25 states which have comprehensive laws, and then we have 5 states, including North Carolina, and I was very involved. That was right before I moved over to my global work. 5 states which have enacted laws that cover bars and restaurants. And hundreds of cities are now taking the lead. In fact, I want to just emphasize, I think Mayor Bloomberg's appetite for tobacco control was really vetted when he was mayor. And he, along with Tom Frieden, who was the Commissioner of Health in New York, actually led the way to passing some of the strongest smoke-free laws in New York, the highest taxes. And, and I think he was really challenged that it's going to be bad for business. And they actually found that, business was happy and workers were happy. And people were still going to bars and not smoking, and it was okay. So in terms of South Asia, I think as you would see, most of the countries have laws. But going back to sort of the standard, most of them allow designated smoking areas, which significantly diminishes the impact of the law. So with the exception of Bangladesh, which technically only allows the designated smoking areas completely outside the building, all of the countries allow designated smoking areas. And so so one of our big pushes in all my countries where we're advocating with the government is to remove that provision because it is exposing people in public places, in bars and restaurants, in government offices. So as you will see, each of the countries allows some form of designated smoking areas in public places. The second policy that I want to talk about is warning about the dangers of tobacco. So this is pack warnings. And I just want to say that this is obviously, the pack is the principal way that the industry is promoting its brand, its image, its cool, hip, pink pack, which talks about the new liberated woman. And well, that's what the industry likes, and this is what we would like. A gaudy picture that covers most of the pack and that warns you that this is not your road to coolness, but this is your road to death and disease. So I think this is a big battle that we are sort of, engaged in globally. And I want to say that this is the policy, interestingly, on which we have the most progress globally. We have 113 countries that have implemented at least 30% pack warnings on both sides of all tobacco products. I want to say that this is the policy on which the US lags really shamefully. We still have the same small statutory warning which from 1985, which I don't think anybody would read or notice. And Obama did try to move forward, but it was sort of held up in the courts. And even though the court allowed for new warnings to be developed, I think sort of there has been inertia and inaction. So I want to say that this has been the biggest challenge when we have lobbied for pack warnings in South Asia, because they're like your funder and your organization, the country you work in, they don't have pack warnings. Why are you trying to do this to our industry in Bangladesh or India. So this is a real challenge. I want to say this is a policy on which my region, South Asia, is actually a global leader. So we have most of the countries. Right now, Nepal is #1 in the world with 90%. India ties with Thailand for #2 at 85%. Sri Lanka, I think, is 4 or 5 with 80%. So most of the region is actually like racing ahead. And in fact, we are contemplating plain packaging. I'm working with the government of Sri Lanka to move a plain packaging bill, which is what Australia, Ireland, and many others have done, where there's absolutely no branding of the tobacco companies. It's a plain pack with just the picture. So you can't even put your name in pink. It has to be in black and white, and there would be no logos allowed. And these are just samples of the packs from the region. And you can see that this is we've got studies now that this is having a significant impact. The third policy I'm going to talk about is enforce bans on tobacco advertising, promotion, and sponsorship. This, as you know, is a really important area because prior to these laws being passed, the largest tobacco budgets, and I think you can ask your friends in advertising, largest budgets for advertising were the tobacco companies. They had the most creative ways in which they would advertise, sponsorship, promotions, giveaways, free products. So this is a really important area. And to be most effective, the ban, once again, like the smoke-free policy, it must be comprehensive. So it must prohibit all broadcast and print media, point of sale, promotion. I want to emphasize corporate social responsibility, which is a huge problem in developing countries. Because most countries, they have needs where they need corporations to step up and support during floods and hurricanes and tsunamis. And that's where tobacco companies are able to come in and stand with the Prime Minister and give away blankets and get in on policy making. So this is a real challenge for us. So here we have 38 countries that have comprehensive bans. The US, I would say, has a mixed sort of report on this. It's where it has banned a lot of forms are banned. But then again, because of First Amendment, there are a lot of areas which have not been banned. I won't go into the details, but again, there is a lot of play here which tobacco companies are still allowed. For example, they can do promotional discounts, internet advertising, so they're still reaching out to youth. And another area which I won't even get into, that's whole worth a 1-hour talk, is e-cigarettes. So all of you, I'm sure, are sort of seeing the intensive e-cigarettes marketing. And the issue is that e-cigarettes are currently not regulated in the US, and I think there's significant debate globally whether to regulate them as a over-the-counter drug, a prescription drug, whether as a tobacco product. And there's sort of pros and cons. So this is sort of one of the hottest debates. And there's a lot of advertising, I'm sure you see, even on various social media for internet products. Again, I want to emphasize the common theme for South Asia is the fact that all countries allow corporate social responsibility, which is a huge loophole because it allows policymakers, in the name of helping the government, planting trees, giving away blankets, doing flood relief, getting in close to the policymaker, the key decision makers, and impacting the way tobacco is regulated. So it's a huge problem. And at the same time, most of them allow a form of sponsorship, which is a huge problem because they really target youth and go after youth events. So the last policy I'm going to talk about is raising taxes on tobacco. And this is really the most effective policy. So over the last 2 or 3 years, our biggest thrust in our work has actually begun, is now on actually fiscal policy. So I'm working closely with economists all over the world. And in fact, Bloomberg's, really been engaged with sort of building capacity and awareness even at the ministers of finance level. And I want to say that there's a huge impact because, I think the data that's really significant we've seen is a 10% increase in the retail price of cigarettes would decrease consumption in low and middle income countries by 5 to 8%. And one of the best case studies we have is from South Africa, which is the graph that's up there, where we saw this sort of dramatic reduction. And we're seeing this kind of studies from other countries. Philippines just enacted a really strong law and they're seeing the reductions. And this is something that we're constantly sort of pushing on. So the global status is that only 32 countries have met the benchmark that the WHO recommends, which is that tobacco taxes are greater than 75% of retail price of the most popular brand of cigarettes. And only 11 of these are low and middle income countries. So I want to say that, and the other important point with taxes is, every year, the taxes must be adjusted for inflation. So very few countries do this. And that's something we sort of strongly recommend. The US status, there was actually a significant tax hike in 2009. And state average prices, the state average tax is 171. North Carolina, as you can imagine, being tobacco country, is one of the lowest in the country. And so, we have one of the cheapest cigarettes. New York has now become the most expensive pack. I think it's over $20 for, with all the taxes. So they have, I think, Mayor Bloomberg's successor has also believed in the policy. So he's continued to actually hike the taxes on tobacco. Again, for the status in South Asia is sort of mixed, and even the countries that show 60 and 70%, I want to say that the price of tobacco is so low that even though they are close to the global standard, it doesn't really have an impact. So one of the measures that we're actually shifting to is the affordability of tobacco products as compared to milk or eggs. And we find, for example, Bangladesh, which is 77%, cigarettes are way cheaper. A pack of 20 cigarettes is probably half the price of a carton of milk or eggs, or 6 eggs. So clearly it's not, the tax is not having an impact, and you have to fundamentally look at sort of the way tobacco products are priced in those countries. I think the common obstacle I just want to emphasize in all the countries in South Asia is the nature of the industry. You have the large industry, a lot of which are sort of partnered with British American tobacco. So one of the things in my work in South Asia, I found that the British sort of left that region 1947, but most of the large tobacco companies in all these countries are sort of either fully owned by British American Tobacco, or India's largest company, they have a 32% stake in ITC, but in Pakistan, in Bangladesh, and in Sri Lanka, they're like the 100% owner of the largest company. And then Philip Morris has significant stakes. So it is really big tobacco. But at the same time, because of smokeless tobacco and BDs, you have a lot of small manufacturers that are hard to find. They're not registered for taxes. There's huge amount of tobacco industry interference. And I'm going to share a case study from India, which was sort of one of our biggest battles anywhere, anytime in the world. The tobacco industry is very involved in litigation. There's a lot of challenge in sort of regulating smokeless tobacco because it comes in so many forms. There's very poor implementation. So even the laws that exist in countries like a Bangladesh or a Pakistan are not well implemented. The government is yet to provide funding, which is also an emphasis of the Bloomberg initiative to make tobacco control sustainable and owned by the government. And the tax system, as I shared already, is pretty ineffective. So just talking about tobacco industry interference, there is a very key provision of the FCTC which requires that tobacco industry does not get to engage in tobacco policy making, which is unlike any other. They are a stakeholder. And if they do engage, their engagement needs to be completely transparent and visible. And as any of you who are familiar with South Asia, that doesn't happen. I mean, it doesn't happen pretty much anywhere in the world where tobacco industry executives get a meeting sooner than I do with the Ministry of Health, and that is never disclosed. They're sitting permanently at the Ministries of Finance. And, obviously, so that's a really important, and in our region, we've seen, for example, pack warnings significantly delayed. There's a huge influence on tax policies. The one thing we're struggling with is that the governments in South Asia actually have a significant stake in tobacco industry. So we found the Bangladesh government has like 6 or 7 board members appointed to the BAT, BAT Bangladesh. So, it's a big challenge to kind of really break the nexus between the tobacco industry and the political powers in these countries, which really impedes progress. And here's just all of the countries, that have been sued for the various policies. You can see the policy that's sued most often is pack warnings, where you've got the US, Canada, India, Australia, all with large litigation filed by Philip Morris or BAT or others. The other Just to give you a flavor, there's around like 1,000 varieties of smokeless products in this region. So it's really hard to regulate who's using what. There's even toothpaste, which is primarily made of tobacco. So, so people use it on a regular basis. So, and it's pretty sort of cultural, it's pretty much 100%. It's like a powdered toothpaste. And so it's really hard. So I'm going to just share briefly, sort of probably the most exciting part of my work. So I lead policy campaigns working with in-country advocates, lawyers, media people, NGOs, sometimes government. And so one of the most intense battles that we sort of went through was India's 85% back warnings. So India was actually ranked 136th in the world in 2014. And at that point, when the Modi government came to power, they had a very strong and dynamic health minister who was an ENT surgeon, Dr. Harshvardhan. And so that's Dr. Harshvardhan. And so Dr. Harshvardhan was very enthusiastic. He wanted tobacco control to be his biggest legacy as India's health minister. So right a month after his appointment, he happened to be in Washington for a global conference. And I had the opportunity to meet with him along with my boss, Matt Myers, who's the president of the Campaign for Tobacco-Free Kids. And he sort of was really asking, how can India is lagging in tobacco control? We have sort of the largest number of deaths behind China. What can I do to actually address this issue? And so we discussed several policy issues with him, and one of which was back warnings and India maybe going from 40 to 60%, and it would probably make India's ranking go from 136 to maybe, I don't know, maybe like at least 20th or 40th or something. And so I think he went back and he actually started a consultation process with in-country advocates. He was really driven and passionate. So over the next 4 months, he actually arrived at, no, we don't want to be 40th, I want to be #1. So I want to actually do 85%. And we were like cautioning him, like, we don't really think it's a great idea to go from 136 to firstly, because the industry will sue, they will do anything to prevent this from happening. But he was an ambitious and driven person. So I mean, obviously, when the health minister of India wants to do something, we as public health advocates are not going to say no. So this is him announcing the India's 85% pack warnings on October 15th, 2014. And he's standing there with the WHO country head. The woman next to him is the head of WHO, and it was a really proud moment. I was actually at the treaty negotiations for the FCTC in Moscow, and it was really exciting to have the Indian delegation stand up there and declare that today our health minister has announced 85% pack warning. They got a standing ovation, and immediately India was asked to host the next COP because of their new commitment to tobacco control. But I just want to say, I think it was too good to be true. Because, I just want to emphasize one thing, that it's pack warnings in India are particularly important because, of the literacy rate. We have, the adult literacy rate is 74%, but it's really, I think even the number is misleading. There's probably effective literacy rates would be below 60%, based on some of the other studies. So I want to say that what Dr. Harshvardhan did was pretty short-lived. I met him 3 weeks later in India, and here we were talking about e-cigarettes, and he was just like, I'm facing a lot of pressure and I don't know where this is going. I want to say, when I landed back here on my flight to India, I heard he had been removed from health minister because of the industry, putting pressure on the government. So he was removed from office and sent to the Consumer Affairs Ministry. And within 2 weeks, they set up a parliamentary oversight committee, which was called the Committee on Subordinate Legislation, which is to look at rulemaking. So what he had issued essentially was not a law, it was a regulation, because India already had a law passed that India is going to have pictorial health warnings, so the Ministry of Health could unilaterally issue regulations about the size and the image. And then, we had thousands of, groups, beedi workers, which is sort of very much used as a front group, farmers group, which started sort of coming out and putting ads in newspaper. The other issue that was actually sort of really prominent and which was very troubling for us was All of these were sort of alleging that this whole pack warnings and tobacco control is a foreign agenda. It's funded by Bloomberg and Gates. It's anti-national. It's trying to kill our tobacco industry. And it's really sort of some hidden agenda, which we can't figure out, but there has to be a hidden agenda from sort of Bloomberg and Gates. And Gates also funds some of our work in India, but particularly in Africa. So you had a lot of that, and that's still not. We sort of recently had a big scare where a couple of our NGOs were threatened with taking their sort of operational license away. And then they filed over 60 litigations sort of throughout the country, in all of the high courts in India, to actually prevent this regulation from going forward. And for a few days, they were like threatening, we'll have to shut down our factories because we just cannot operate, and jobs would be lost. So sort of our response, I want to say that this was probably, I've been involved in a lot of policy campaigns, both in my work in North Carolina and globally, and I think this was really exciting. So on that committee on subordinate legislation were sitting two beedi barons, the biggest two members of parliament who were owners of beedi factories. There was the chair of the committee, which made global headlines, actually said in open meeting was that there is no Indian data to prove that tobacco causes cancer amongst Indians. So all this is foreign data which is being thrust upon us by this foreign hand. And so that was sort of obviously, so the pack warnings were to actually go into implementation on April 1, 2015. So I want to say one of the most exciting weeks in sort of working intensely in sort of policy advocacy was the week prior leading to this, where we managed to get sort of all of the leading news channels in India, CNN, IBN, and all of these 24-hour news channels. India is the largest number of 24-hour news channels that I'm aware of, and all of them kind of had like, probably collectively what we got like maybe 200 hours of electronic news, all the talking heads panel discussions, where we got these members of the COSL to come and talk about their position that tobacco does not cause cancer in India, as well as we had some favorable MPs. We did a big press conference. So that week actually resulted in what the press called Tobacco Gate in India. And we, the Prime Minister took notice, and I just sort of shared a headline from April 5th after that sort of culminating event where the Prime Minister said, so what's all this hullabaloo, and so I think he kind of took notice and said, let's relook at pack warnings. The other thing is, I actually went to Duke Law School. I'm a lawyer, so we had a team of 15 lawyers that, I was working with sort of across the country, and we sort of obviously pushed back. We had, interveners supporting civil society in all of those high courts, trying to actually get the law implemented and making sure that industry does not get a stay. We actually brought 4 members of parliament from sort of various parties on a study tour to the US. We just didn't show them the US pack warnings, which didn't exist, but we talked about other forms of commitment to tobacco control. The other big sort of partner in our work was the medical community. We had worked very long with oncologists across India, and especially with the leading the sort of Tata Memorial Center, which is sort of the government's leading cancer center. And so they spoke out very strongly. So we had really visible, sort of medical leaders, the Indian Medical Association and others sort of speaking out. And then, I think our big victory came sort of April 1, 2016 is when the pack warnings, that sort of the new implementation date, which was a year later. And the industry was still sitting around for a month. And May 4, 2016 is when the pack warnings actually got implemented. So I wish I'd remembered to bring a pack, but it is really exciting to see sort of 85% pack warnings. This was something, a huge number of partners, all of us sort of lived and breathed for this 2-year period. I just want to say that, the recent study by Hopkins showed 66% of the pack warning, of the cigarette packs were compliant, and 80% of BDs, which was a big relief, because even when the pack warnings were 40%, none of the BDs were compliant. So I think we've sort of worked very closely with enforcement authorities and states. The other exciting data was that India just released its second round of GATS data, which is the Global Adult Tobacco Survey data, which showed increased effectiveness of pack warning. So you saw a significant increase from GATS 1 to GATS 2, which went up like for cigarettes from 38% to 61.9% about the pack warning, encouraging them to think about quitting. So which is really impressive. And the biggest excitement was we actually showed a 17% reduction in overall tobacco use. We were not even in India with 2017, which was really remarkable because in a country as large and complex as India, and this is one of the policies, I think we've been working intensively in all the policies. So in 7 years, we showed a 17% reduction in the new GATS data. So that was sort of huge and impressive. And I'm actually going to be sort of talking to Bloomberg Philanthropies about sort of the data and stuff next week, because this is sort of their biggest country win. So I want to end with this image and just want to share that. So, one of the ways we try to reach out to policymakers in India, because, data can only tell have that much impact. So this is the image of an oral cancer victim. Her name is Sunita. And she actually became the face of our pack warnings campaign in India. So she started using smokeless tobacco, probably, I think, right before she was 20. I met with her, and we actually, the Bloomberg sort of philanthropies ad campaign, which the Indian government launched, had her sort of contracting oral cancer at 22. And so she actually, all of the change.org petitions where we got hundreds of thousands of signatures, our paid media campaign, which was run by the government, all talked about Sunita's story, where she talked about, I wish I'd known about the harmful effects of tobacco, I would never have started. And I just want to say that it still sort of affects me that she actually died the day the pack warnings were implemented, on April 1, 2016. So that was really, sort of big, and to all of the advocates, we found out that she had passed away. She actually had visibly appeared in events for us and been the face of the campaign. So thank you, and I'd be open to questions.